Hi, my name's Aaron McDonald. I'm an anatomy lecturer at La Trobe University, and in this clip we'll be looking at the structures of the posterior forearm. Just reviewing again the forearm, we have our muscles coloured in blue here, indicating the anterior forearm and the flexor and the pronator compartment, and the posterior aspect of the forearm, the posterior muscle compartment, is found here in the orange. The borders for the posterior forearm are here. We have the ulna, our interosseous membrane, obviously a membrane between bones, and we have the radius. Also our antebrachial or our deep fascia, this connective tissue here. Some people like to divide the posterior muscle compartment into different groups. We can see here we have one group which contain muscles that extend and abduct or adduct the hand at the wrist. So these are muscles that are just passing distal to the wrist joint and inserting onto bones just in the hand, so the carpals or the bases of metacarpals. And we can see here the extensor carpi radialis longus. It is originating from the supracondylar ridge just above our lateral epicondyle, and it travels along and inserts, passing over the posterior to the wrist joint and inserting onto the base of our second metacarpal. Extensor carpi radialis brevis, from what we call our common extensor origin, and this travels through under the extensor retinaculum and inserting onto the base of our third metacarpal. Another muscle that will act only at the wrist and not at the fingers is our extensor carpi ulnaris. So as we can see here, running deep to the extensor retinaculum again and inserting onto the base of our fifth metatarsal. Just reviewing these muscles, they're all crossing posterior to the wrist joint, so they'll be acting at the wrist to produce extension. You'll also see that our extensor carpi radialis longus and brevis are found running lateral to the wrist joint as well as posterior, so these will help in or assist in adduction at the wrist. And our extensor carpi ulnaris running medial to the wrist joint and posterior will also assist in adduction. Another muscle group that we can talk about is muscles that extend the medial four digits. So our medial four digits, our index down to our digiti minimi, not including the thumb. We have extensor digitorum and extensor digiti minimi, again coming from our common extensor origin, and our extensor digitorum running along underneath the extensor retinaculum, travelling all the way to insert onto our medial four digits. Extensor digiti minimi, as the name suggests, branches off from the extensor digitorum, so we have a muscle slip from the extensor digitorum travelling by itself under the extensor retinaculum and inserting onto the digiti minimi, or our smallest digit. Obviously this muscle acting on its own will produce extension of our medial digit. Another muscle we have called extensor indicis. We follow it through under the extensor retinaculum again, and it's going to just to our index finger. You'll notice that we also have these intertendinous connections, so connections between the tendons of extensor digitorum, and this makes it difficult to extend one digit while the other digits are flexed, and especially the ring finger. All of these muscles insert onto structures that we call the extensor hood or extensor expansion, and that ensures that any of these muscles travelling through and inserting onto the extensor expansion will be crossing our distal interphalangeal joint, the proximal interphalangeal joint, and our metacarpophalangeal joint. So all of these muscles will be crossing all of these joints posteriorly and therefore acting at all of these joints. Another way to subdivide the muscles in the posterior compartment could be muscles that produce extension or abduction of the thumb, and therefore obviously are inserting onto the thumb, and will have pollex in their name. We have abductor pollicis longus, a muscle travelling along and inserting onto the thumb. My big advice here is to familiarise yourself with movements of the thumb first. We have extensor pollicis brevis. As we can see, our extensor pollicis brevis is travelling along and inserting distally onto our pollex and will produce extension. And again, we have another extensor pollicis longus muscle. And this is travelling around this dorsal tubercle, separating the extensor pollicis longus from our extensor pollicis brevis. And this creates a little region here that we can name specifically the anatomical snuff box. So what I want you to do is to identify the structures that are forming the boundary for our anatomical snuff box. Here we have a muscle or a tendon of a muscle, and we can see it's going to the thumb, so it will probably have pollex in its name. We have this thickening of connective tissue here, and we have two muscles here forming this boundary here. So on LMS, please try to identify these structures and label them, so therefore you'll be labelling the boundaries of the anatomical snuff box. We have two muscles that don't act at the wrist or the digits coming from our posterior muscle compartment. We have our brachioradialis. So this is our most proximal muscle of our posterior muscle compartment, coming from our supracondylar ridge, just above our extensor carpi radialis longus. And this muscle travels along and inserts onto the distal aspects of the radius, hence its name, brachio, from arm, to the radius radialis. Although the brachioradialis is originating from a similar area to all of our other posterior muscles, and it is innervated by the radial nerve, this muscle actually produces flexion at the elbow. As we develop, the upper limb rotates slightly laterally. We're aware that the lower limb rotated medially around 180 degrees, and the upper limb rotates laterally. During this rotation, the brachioradialis slips to the anterior aspect of the elbow and therefore will produce flexion at the elbow. The brachioradialis is most active when our forearm is in mid-prone position, and that's why we call it our drinking muscle. The other muscle, the supinator, you may have already looked at or seen when you've seen the film clips on the radio-ulnar joints. So we can see our supinator from the common origin, the lateral epicondyle, our ulnar, and it's wrapping itself around the shaft of the radius. And when it contracts, it would obviously produce supination at the radio-ulnar joints. The extensor retinacular is shown here. It is a thickening of our deep fascia, and we can see all of our tendons are running deep to this extensor retinacular, and they're covered by these synovial sheaths. When you're looking at a diagram such as this, I think it's really good with both the hands and the feet in trying to figure out where the tendons are travelling to, and this really helps us in naming the muscles. So any of these tendons travelling to the thumb will have pollex in their name. So all we do is look at where they're travelling to, and if I can see that this muscle here will pull the thumb out, that would produce extension. So I would know this must be extensor pollicis something. If I look at the tendons going to the index finger, it may have indices in it, or it might have digitorum. So any of these here will be either called digitorum or indices for this digit, or digiti minimi here. Other muscles here that are not inserting onto the digits, so they won't have digitorum or pollex in their name. They're essentially crossing and will be acting at our carpals, so they could be carpi, and anything on the thumb side is radialis. Anything on the little finger side is the ulnar. So what I want you guys to do is to have a look at all of these structures and try and name each of these structures here. This is just a little bit of information. Again, others may want to divide the posterior muscle compartment into a superficial layer containing the muscles here that we've just spoken of, and a deep layer, again, the muscles that we've already covered here. This is just another way you may like to try to separate the muscles of the posterior compartment. And finally, we just want to look at the nerve that is innervating the posterior muscle compartment of the forearm. We remember we have our 5 terminal branches from our brachial plexus, the musculocutaneous, auxiliary, radial, median, and ulnar. Of those, the auxiliary nerve and the radial nerve are the only 2 that contain the posterior divisions. So these are the only 2 capable of innervating muscles that extend. And as we can see, the auxiliary nerve finishes up here, innervating the deltoid and teres minor. So the only other nerve available for innervation of muscles that extend in the forearm, our posterior muscle compartment, must be our radial nerve. You'll see this in a further clip coming along on the innervation of the forearm. So as it says, it divides superficial and deep branches. Superficial innervates the dorsum of the hand, just the skin, and our deep travels posterior, piercing the supinator, and it's referred to as the posterior interosseous nerve.